I think another important aspect of understanding the supply issues is also ensuring that we have the adequate public health workforce to conduct the testing and the contact tracing while we're still vaccinating individuals. And I was glad to see that the American Rescue Plan includes resources for testing and a greater public health workforce. I also understand there was some testimony just yesterday in another hearing that state and local governments have diverted some of the resources for testing and contact tracing to vaccines. And so what do you think, starting with Dr. Morita, what do you think can and should be done to ensure that the proper resources and personnel are allocated to testing and tracing?
Your point is well taken. When we spoke with during the transition period of time, we spoke with a number of state and local health officials, and what they reported was they were really struggling in terms of manpower, because it was the same people that were being asked to do the testing, to do the contact tracing, to do the outbreak investigations, and to start planning for the vaccine. This is prior to the vaccine being available. And so there just are insufficient numbers of staff that are actually available. What has to happen is really ramping up and shoring up that infrastructure with staff right now for the immediate response, but then looking at how to sustain that for the long haul, because it's really difficult to hire a bunch of staff within state or local governments and to get them mobilized and have them trained up to actually do the kind of work that's necessary, rather than having an existing solid network of workforce that can actually respond when the crisis actually occurs. I think I agree with Dr. Borio in terms of there needing to be a testing strategy. And in order to have a strategy that really, it won't all be just public health workforce that is doing the testing. It can rely on healthcare providers that are in the communities, in health centers, in clinics, in hospitals, doing some testing as well. Just because I don't think that the workforce necessarily has to do the testing on an ongoing basis. It can be a coordinated effort with other providers as well.
Terrific. Thank you for that. Would anyone else like to weigh in with their thoughts on that question?
I will simply remind us all that during the early part of this pandemic, we were in a big hurry to get tests, and a lot of tests went onto the market, and a lot of damage happens when tests are inaccurate on either side. And so, while there needs to be a testing strategy, part of that has to be accuracy and dependability. And a test is not a test. That is not a test. They're not all the same.
Thank you for that. And thank you all again for your insights today. I am just out of time, so I will yield back. Thank you, Chair Oneshu.